Okay, I think we can get going if that's all right. Welcome everyone to this webinar on building healthcare professionals' confidence in COVID vaccination across Europe. Lessons learned and learning, I would add. This is an ongoing journey for all of us. This particular webinar draws from what has been 6 to 8 months of local webinars across Europe, starting with Romania, but we've had a number of other countries, and then bringing together across a pan-Europe gathering here today, which we're really thrilled to have all of our speakers here today, some of which will be contributing from those local webinars. Additionally, together with Team Halo, we also wanted to really look at the issue of social media and peer-to-peer engagement, and we've had a great collaboration with Team Halo, who's contributed across the webinars and today. And basically looking at insights we've gotten through the experience with social media and opportunities to do more. I think I'll get going. I want to save as much time for the speakers themselves. I'm really thrilled to be able to introduce Brett Craig, who will start off with our opening presentation. He's from the World Health Organization Europe office in the Vaccine-Preventable Diseases and Immunization program. And he'll be particularly presenting on the role of healthcare professionals in COVID vaccination. So over to you.
I'm happy to present. Hello, everyone. I'm Brett Craig, and I work in the World Health Organization, the regional office for Europe. And I've been working the last year and a half on supporting countries with the COVID-19 vaccine, particularly in the area of acceptance and demand for COVID-19 vaccination. And this has included a variety of activities, but one in particular has been about supporting countries gathering insights, especially from priority groups on drivers and barriers to vaccination, including health workers, but also among other population groups, which I'll talk more about in just a second. But I'm happy to be here and share with you the insights, and especially how they relate to the role of healthcare providers, specifically in the vaccination process, and the importance that they have in building vaccine confidence. Just as an overview of this, is something that I think is not new, and not new probably to anyone on the call, but just to kind of set the groundwork, what we're really talking about here in terms of how healthcare providers can build and impact vaccine confidence. They continue to be, and this has been held true with COVID-19 vaccines, healthcare providers continue to be the most trusted advisors and influencers of vaccination decisions, particularly when they make a strong recommendation. That's seen to be a strong facilitator of vaccination uptake, and their relationship with patients is very supportive for patients to be able to make that decision to vaccinate. And this is often because patients do require this consistent and accurate information about vaccine safety and benefits from all their healthcare providers, but it needs to be also shared in a respectful and positive manner. And so that last point is particularly important, as it can work in both ways, this influence, right? That we know that providers can underestimate their influence, that they don't take advantage of this opportunity, or that it could be for a variety of other reasons as well, that they don't have enough time to talk, or that they themselves aren't confident in the vaccines and don't make that strong recommendation. But also, again, when it's utilized, and when the full potential of this impact that healthcare providers have, it can be very effective in helping patients to make the decision to vaccinate. So this is all, background knowledge on moving into COVID-19 vaccination specifically. I hope to provide a little bit more deeper insight into how this actually takes shape with the issues surrounding COVID vaccination, and particularly for specific population group. So first, just to share some actual, just some basic findings from across countries in the European region. This is from WHO's Behavioral and Cultural Insights Unit has conducted behavioral insight surveys. Actually, in many countries, there's been more than one, several rounds of these, but overall, some of the relevant findings include the fact that trust in healthcare providers, again, increases the intention to vaccinate against COVID-19 and the likeliness to have been vaccinated. And this has been true across countries. And towards the end of 2021 and 2022, we can say that those surveys still being conducted at that later stage in the vaccination rollout, those with high intention to vaccinate were still much more likely to trust the healthcare provider specifically. And this was important because as we talk about trust in healthcare providers, we can talk about two levels of trust. One is general trust in the profession itself, but one is specific trust in the actual healthcare provider who's right in front of them, who's going to actually recommend vaccination and actually give them the shot. And so it holds true in both cases, but especially those who have high intention to vaccinate need to have that trust in the specific healthcare providers with whom they are interacting or they're consulting with. So the opposite, as I said, is also unfortunately true, that those with lower levels of trust in healthcare providers showed to be a driver for low vaccination intention and for those who are unvaccinated. So this holds up in the survey data, but what does this actually mean in more detail? And so I'd like to present a little bit about the qualitative research findings that we have had across countries and how it's given us a little bit more of a description of not only whether or not healthcare providers are the most trusted source, but how does this actually take shape? What does it mean for individuals and for healthcare workers, actually interacting, and what are the issues that help them to have trust, and also why is it that they need this trust from their own personal healthcare providers as well. So this has been conducted through country level qualitative research that using a rapid qualitative research approach, which we developed this tool and have supported countries with it. The rapid part really comes not so much in the data collection, which is still done with fairly traditional qualitative research methods such as focus groups and in-depth interviews, but actually in the analysis process, which can be very time consuming to transcribe and sometimes translate all of the recordings. This was a method that's been developed by experts that consulted with us. We adapted for this particular purpose in order to train members of the research team to analyze and categorize data based on listening to recordings and using spreadsheets that identified the different key findings and build summaries around the findings as they listen to recordings of the focus groups and interviews. And so this really assisted with finding a more of a rapid approach to having findings ready to make recommendations based on this to countries. And to give you an overview, this is the countries that this method has been conducted in, and many of these countries have done more than once with different groups, and health workers being one of the priority groups that really we've learned a lot from. But then also the more common group that we've targeted for this research has been older adults and those with underlying conditions. So staying with those priority groups for COVID vaccination. Now, the framework we use for understanding not only what the findings are, but how to translate those into recommendations for action to increase vaccination uptake. We use a behavior change model known as the COM-B, but basically what it provides are insights into 4 different factors that contribute to the behavior, which is vaccination. And just to present to you some basic findings overall on each of these factors, the first factor being the level of knowledge, what they know about it. And we find that knowledge about COVID vaccinations, even among healthcare providers in many countries, many areas, remains low. There's still confusion about vaccine safety and effectiveness, why there are different vaccine products, et cetera. We continue to find that not all information is available in local languages. And also, even if it is available, it's not easily understood, even by healthcare providers. We find that a lack of official information compared to the amount of misinformation that's being shared and spread, especially more in rural areas where the official information doesn't always reach as well. That creates an imbalance, and it just tends to distort people's perceptions of safety and effectiveness of the vaccines. Regarding their attitudes and intentions to vaccinate, this is where we really learn about these key findings about some of the main reasons, some of the main barriers, especially for those who are older and those who have chronic conditions. They are concerned that their health and their age actually increases their risk of complications with COVID vaccination, that their general sense of health or frailty makes them more likely to have a severe reaction to the vaccine. This leads them to believe that they need a medical exam before vaccinating, which exams can cost money and cost time and might present additional barriers, even if they're not necessary, but they're perceived to be necessary. And also, many of the policies or the restrictions put in place around COVID-19 during the pandemic weren't applicable or did not motivate some in these categories, especially older adults, to vaccinate because they weren't as affected by travel restrictions or by work requirements, for example. Additionally, we found that with regards to their social environment, they continued also from a qualitative standpoint. We learned that health workers continued to be the trusted source. But even then, we find that many health workers may not be promoting vaccination, even if they've been vaccinated themselves. And also, even if they are not opposed, or even if they have a fair amount of confidence in the vaccines, some health workers, if they're not directly involved in COVID vaccination because it was being done still as an emergency response at dedicated COVID vaccination sites, then they were not necessarily recommending and having conversations about COVID vaccination with their patients. We found that health workers still many times feel that they don't have enough information about vaccine safety and effectiveness. And also many report just an insufficient amount of positive communication overall. Find that in addition to healthcare workers, opinion leaders can be influential in communities, especially smaller communities, but many of them are also hesitant, that they don't feel it's their place to recommend vaccination, or that they feel hesitant to recommend because they don't know if they can answer the questions that people have based on rumors and other information they hear in the media or on social media. And lastly, the factor of making sure that people still have convenient access. While vaccine supply has certainly increased and many countries have more than enough doses, there still can be access barriers, especially for elderly in rural areas, involving travel and costs and scheduling, et cetera. Especially scheduling online can be a challenge for some. And then additionally, many countries have used mobile vaccination clinics to try and reach rural areas. But if it's not planned well, if communities are not prepared ahead of time to receive these mobile vaccination clinics, then they can be less effective. So to show how these different factors interact and actually show how important the role of the healthcare provider is in this scenario, I was just going to share with you a narrative of from the perspective of an individual, and what this might look like, to give you that perspective. So in essence, let's say this is Rosa. Rosa is a 65-year-old woman, and she has diabetes, and she lives in the village, so not really close to the city. She is, of course, aware of COVID-19. She's had some neighbors who got very ill with it. She has heard that her health and her age might make her much more at risk of severe disease. And it's made her actually quite nervous about catching COVID. She's heard about the vaccines, but she also isn't sure. She has questions about it. She's not sure, is it right for her? Is it safe? She has heard family members say both positive and negative things about it. So she's a bit torn on that. She's heard rumors on social media or from others, as well as on the news and on the TV, that vaccines are available. She's heard the messages from NGOs like UNICEF or WHO that vaccines are safe, but she hasn't heard whether they are safe for her in her case of diabetes, because she often doesn't feel very well. She has a hard time managing her blood sugar levels, and she thinks that maybe it might not be something that's so safe for her, especially since the vaccines are so new. She remembers last time she traveled to the primary healthcare clinic, passing a billboard saying that everyone should vaccinate. But again, it doesn't say anything about people in her specific situation. Now, her most recent visit to primary healthcare, her GP, her family doctor, was about checking up on her diabetes, and the doctor talked to her about all of that, but the doctor didn't mention anything about COVID vaccination, and Rosa didn't feel like there was time to actually ask questions, and so she didn't bring it up either. And thinking back, she wonders if it was so important, or if it was something I should do, wouldn't my doctor have recommended it to me? Wouldn't the doctor have brought it up? And so she's very confused still, feeling like she hasn't gotten any straight answers. She is not opposed to vaccination, but she does have certainly concerns about her own health and safety regarding getting a COVID-19 vaccine. And then one day, she sees that a mobile vaccination clinic has arrived in her village. She sees some people standing around the medical van, and not seeing a lot of people go up there and get vaccinated. And she peeks out her window and watches it for a little while. But ultimately she decides that, well, my doctor hasn't told me it's safe. These people don't know my health history. They're not my doctor. And therefore, I'm not sure if this is still something I should do. So she waits, and eventually the mobile vaccination clinic leaves the village, and she's left still in the same situation. So this is just to, again, pull some of these findings together from the different factors to give you what it must be like from the perspective of an individual facing this concern about their own safety with regards to COVID-19 vaccination. This is based on findings from numerous countries, but especially more recently, I'd say within the last 4 to 6 months, that we have started to really see this finding consistently in countries among older adults especially, but also those with underlying conditions, that concerns of vaccine safety, not vaccine safety in general, but actually vaccine safety for specific chronic or health conditions, based on an understanding that the vaccines supposedly haven't been tested enough on these particular groups, or that the COVID vaccines themselves cause much more severe reactions. And that based on that idea, that if you're already unwell in some way, then it must be even worse for you. So just to finalize, the reason why healthcare providers are so important in building vaccine confidence in this case is that it's not their profession or their expertise alone that makes them the trusted source in vaccination, but it is that combined with their familiarity with the patient's individual health conditions, with them having, if they are a trusted source as an individual provider, the one who knows the patient's health history, the one who is willing to answer questions, address concerns, and make the patient have more confidence, and make that strong recommendation that they individually need to get vaccinated because of their underlying condition, because of their age. That is where the role of the health worker really needs to be strengthened in many cases. And so that's just a general idea. And I know I think I'm out of time. So just very briefly, in order to respond to these findings, we've been working with countries on targeting these particular groups, both health workers and older adults, and helping move COVID vaccination into a primary healthcare setting where these conversations can happen more regularly, where people with concerns can be reassured of their individual health condition being safe for vaccination. Also using mobile clinics effectively to partner with local healthcare workers in order to build confidence among those community members, and then working with other community leaders and other health authorities, providing information on these particular topics as well. So I will stop there, since that's the end of my time, but I'm happy to answer any questions. Thank you.
Thanks. Thanks so much, Brett. We do have, and actually fascinating different perspectives on this issue, and I particularly resonate with the one where you talk about not just having the information right, but understanding the context of the individual and their other factors. We do have a question from Aoife. Very interesting presentation. Were there any findings on which healthcare providers are particularly trusted? You know, for instance, a pharmacist or nurse or GP, or yeah, that might also vary, but just to get your perspective on it.
1 second. Okay. And so, yeah, that's an excellent question. And just real briefly, I can say that it tends to be the family doctor, simply because that is who many of these individuals have the most contact with, and that tends to be who they refer to. But we find, from a strategic standpoint, in order to reach the patient and build confidence, it's really important to include kind of the whole healthcare team, simply for a couple of reasons. One is that they want a recommendation from the family doctor because they're the doctor. But then many of these with chronic conditions also see a specialist. And so if their concern is about their health condition, then they're going to want the specialist about that condition to reassure them as well. But also nurses often have a lot of the actual conversations and FaceTime with patients. And so they also need to be helping build that confidence. The question about pharmacists is great. We haven't done a lot of research to identify whether pharmacists are more trusted, but we have utilized this finding of healthcare professionals in general being trusted, and as well as how can these contact points with healthcare professionals be utilized, and pharmacists in actually a couple of countries like Moldova and in Armenia, just as an example, we've launched some campaigns in order to train and prepare pharmacists to have conversations with customers about COVID vaccination itself. Again, just to have another contact point. And often they might have more time to have a conversation than a GP, for example, with the patient. So it's just strengthening that conversation and that confidence, utilizing the whole healthcare team.
Great, thanks. That was a good comprehensive. I like the fact that it's family doctors, but with chronic conditions, but the nurses. So it really is a team. It takes a village, as they say.
Right.
We have a question from or a comment question from Sweden. The findings you describe are consistent with what they are seeing in Sweden, but a major problem has been accessing healthcare providers due to long waiting lists. I think that's in a number of countries. Are you, presumably meaning WHO, working to address this issue? I think at the end of the day, it's probably a country responsibility, but I'll throw the question over to you.
No, exactly. I mean, in short, it involves different decision makers, different levels of those involved. And I know with WHO has been working, in primary healthcare as well for a long time on addressing this difficult balance of helping those working in primary care to allocate sufficient time with patients as they need it, but at the same time being able to see as many patients as are needed. And so that's often a more of a structural issue that can be addressed. But certainly from a training standpoint, when we do trainings on communicating not only about vaccines, but just with patients in general, there is a focus on how to communicate effectively without taking more time that is needed. So it is tricky. It's something that, yeah, we continue to work on.
Great. One more question. I think probably final question given our time here. From the UK, Miriam is asking, we have a big difference in vaccine uptake between the most and least deprived wards in Liverpool, 40% difference. That's quite significant. Are there additional communication messages to target the most deprived and those over, I guess, deprived areas who are overcome with misinformation? Yeah, that's
excellent question.
Multiple settings. Yeah.
Yes. Yeah. No, definitely. And I think before jumping too much towards what messages might work, that's really where you want to make sure you have insights into that population in order to understand, first of all, if there are other barriers beyond misinformation, right? And what we often find is that misinformation certainly causes people to pause or to have questions or be concerned, not necessarily to be against vaccination, right? And so it's a matter of identifying how to reach those who have these concerns and how they can be resolved. And oftentimes it is with trusted healthcare professionals who can resolve those concerns. But if they're in deprived or underserved areas, as you said, then it might be that an effort on the part of primary healthcare to go out, whether it's mobile vaccination teams or actually just holding meetings or events in schools, for example, that can be information sessions that can show an initiative to be in the community rather than simply in the healthcare facility itself. So the messaging comes after that, and the messaging needs to be tailored, obviously, to if the concerns are about, actual health concerns, are the concerns about rumors or conspiracy theories, et cetera. I mean, the messaging needs to match whatever the concerns are for those specific groups. And sometimes they might be very unique to for example, if you have an immigrant population that is, more recently arrived, that has concerns about whether they're allowed to access healthcare, whether they have legal concerns about documents or whatever it might be that keeps them from wanting to engage with the healthcare system for a variety of reasons. It might not just be vaccination alone. So those are just considerations to keep in mind, but the messaging needs to be tailored to whatever insights you can get on the barriers of those specific groups.
Great, thanks. And I think your point to listening to the concerns and making sure the information you're putting out there is kind of, or what your intervention is relevant to that, which is probably pretty distinct for different populations. Well, thank you so much. That was a great opener for the webinar today, and really comprehensive. And we'll now hear from some specific countries. And I'm going to turn over to, so thank you very much. I'm going to turn over to Dr. Jacques Dahala, the CPME past president and chair of the CPME working group on vaccination, who will moderate the next part one of the webinar. Thanks so much.
Thanks, Heidi. Thank you for this introduction, and also thank you for to all the people who organized this webinar. I think we need to remain motivated. We need to remain alerted to the problem of hesitancy, and yeah, seminars like this one do help. So thank you very much. I first introduce a colleague we know very well at CPME. That's Dr. Vesna Stefancic-Martic. She has a master in public health and is chair of the Public Health Committee of the Croatian Medical Chamber. I'll be short with presentations, with introductions this afternoon, because you only have 5 minutes to present us insights from Croatia, excuse me. So I give you the floor right now, and I'm ready to enjoy your insights. Thank you, Vesna.
Thank you, Dr. De Haller. Good day, everyone. I will try to keep it short. So, as all of you are aware, Croatia is a very beautiful country. We have a population less than 4 million people. And besides the fact that Croatia is very beautiful, unfortunately, during this epidemics, we didn't have such beautiful numbers regarding the COVID cases. So a bit more than 1.11 million cases were recorded, and a bit less than 16,000 people unfortunately died. Regarding the vaccination in Croatia against COVID, the complete vaccination finished only 55% of the whole population of Croatia, and 57% got at least one dose of vaccine against COVID. So what did we decided to do? When I say we, I think of our 9 medical chambers in Croatia who decided to take the initiative and try to make certain steps to increase the awareness of vaccination against COVID among healthcare professionals. So we were aware that vaccination is of most important thing that should happen among healthcare workers during the epidemics, and our goal was to achieve at least 70% of the rate of vaccination among healthcare professionals of at least 70%. So what did we do? We started a certain campaign that was named "You Have the Knowledge, Be an Example," thinking of all the healthcare professionals in Croatia that need to be an example to their patients. So what did we achieve? Among almost 19,000 healthcare professionals in Croatia, we had many different activities, but the most prominent were webinars. That we had 3 webinars that involved more than 10, 11, and 13,000 participants in Croatia. So this is a number that we are very proud of. So most of them graded our webinars with a very high grade, 5.7 out of 7, and almost 83% of healthcare workers who participated our webinars and who were aware of the campaign at the national level, they said that it's a very high quality campaign. So here are some of the results in January and in May 2021. While the general population vaccination rate in January in Croatia was very low, it was 1.4. Our healthcare professionals were almost already vaccinated in the 23% of healthcare professionals were already vaccinated, and almost half of them were planning to get a jab. But in May, at the end of this campaign that we managed to provide to our healthcare professionals, while the general population vaccination rate in May in Croatia was a bit less than 21%, we had already around 82% of our healthcare workers vaccinated already, and around 9% who were planning to get a jab. All the numbers of professionals who decided not to get vaccinated was low, was 14% at the beginning of January, but it became 4% in May. And this is also something that we are very proud of. Also, beside this campaign that I've mentioned, we are very happy that we had the opportunity to participate in the webinar by Vaccine Confidence Project and London School of Hygiene and Tropical Medicine that was held in Croatia on 8th of February. We had also more than 500 participants, and the most prominent results of this webinar were that more than half of participants had increased their confidence in addressing vaccine hesitancy after the webinar, and around 60% of participants has increased their willingness to recommend COVID vaccine to patients after they attended the webinar. So this was a very nice thing for us to have as an information. When we talk about fundamental concerns of Croatian healthcare professionals, we can say that they're either similar or overlap with the concerns of the general population. Here are listed some of them. Those are things that many people in general population were considered about, especially at the beginning of epidemics. But as the time was passing by, we noticed a slight differences between healthcare professionals. In example, most of the fundamental concerns that medical doctors in Croatia had regarding the vaccination is how to address all those concerns that their patients and the general population have, for example, and the nurses had more concerns in general than doctors, and might need to be convinced to get vaccinated themselves so they could be more likely to present and recommend the vaccine to others, to the patients. When we talk about key challenges, here are listed many of the challenges that are not present, that were not present during the epidemics only in Croatia, but they're characteristics for all of the health professionals during the epidemics. But besides these key challenges and maintaining resilience and professional dedication, our healthcare professionals often needed to face all the challenges that are connected with the vaccine hesitancy among their patients. So they needed to take into account their personal beliefs, different ideologies, the confusion, the lower level of health literacy sometimes, and understanding of the context of the vaccination, and also their own personal judgments or even mistrust in healthcare authorities. So in conclusion, I would like to say that beside the fact that there are, and it is of utmost importance to keep the healthcare professionals very closely involved in decision-making processes regarding the implementation of recommendations and interventions that address vaccine hesitancy. It is of great importance to constantly work on building the trust in healthcare providers and institutions via genuine engagement and dialogue, as well as to increase vaccine knowledge and awareness among general population. Thank you.
Thank you, Esma. Thank you very much for these insights from Croatia. It is a beautiful country indeed, but it's also a very interesting presentation. Thanks a lot. We now jump to France, and I have the pleasure to introduce Madame le Docteur Amandine Gagneux-Brunon. She is working on infectious disease and tropical disease at the hospital, University Hospital of Saint-Étienne, and will give us also 5 minutes of insights from France. Amandine, you have the floor. Thank you.
Thank you, Jacques. Thank you, everybody, to give me the opportunity to present some insights from France. The situation in France is quite particular because vaccination for healthcare workers became mandatory since the 15th of September 2021. So to better understand and address vaccine hesitancy in healthcare providers, maybe we have to focus in attitudes and intention to get vaccinated at the beginning, before and at the beginning of the COVID-19 vaccination campaign. So, excuse me. So since April 2020, we tried to work about the intention to get vaccinated in healthcare workers in France. And so at the beginning of the pandemics, as we were at home with lockdown and very busy in the hospitals, intentions to get vaccinated were very high in healthcare workers, around 77%. But we observed differences between gender, with less intention to get vaccinated in women and in younger healthcare workers. And we observed great differences between the professions and the jobs. Nurses and assistant nurses were less often prone to get vaccinated if a vaccinated was available. So in December 2020, and between December and February 2021, we also work with healthcare workers and the intention for COVID-19 vaccination. And we used a model, the 5C model, and with adaptation to COVID-19. And we observed that during this short period, we observed a strong increase in intention to get vaccinated when the vaccination campaign was launched. And so we can observe that as in the general population, healthcare workers had to be confident in the vaccine. They also considered vaccination as a collective responsibility, but intention to get vaccinated were also driven by social conformism and confidence in systems and particular authorities and employers. So as in the general population, we can see that healthcare workers had many concerns about vaccine safety and had fear about side effects. And of course, healthcare workers more confident with vaccine safety were more prone to get vaccinated and to also recommend vaccination. So we also we observed also that family environment opinion about COVID-19 vaccine had an impact on the intention to get vaccinated in healthcare workers, whatever the professions. It was real in nurses, assistant nurses, but also in pharmacists and physicians. So we also could observe that healthcare workers who considered that benefits from the vaccination were largely greater than risk, were more prone to get vaccinated. So there were a form of calculation for healthcare professionals too. So we confirmed that it was previously observed with other vaccines that healthcare workers are also hesitant and share concerns with the general population. And so we have to more train healthcare workers about vaccines and particularly about vaccine safety. So maybe a very important issue is the issue about trust. We can see that general population had to have trust for general practitioners and healthcare providers. But you can see that here you can see the physicians, the students, here the nurses and the assistant nurses. And there you can see that it's the trust in colleagues, here in general practitioners, and here in employers, and here with the health authorities. And we can see that there is a great difference in trust between the different last slides, impact of trust in employers and health authorities. Thank you.
Thank you very much, Amandine. It's quite interesting to have numbers and facts to reflect upon, and I thank you very much for this and for all these studies and data. We now go to Romania, and I'm very happy to introduce Dr. Sandra Alexiu. She is president of the Family Practitioners Association in Bucharest and is a primary care physician which I very much appreciate too, and works in vaccinology and microbiology. Sandra, you have the floor, and thank you very much.
Thank you. I am the one who's thanking you very much for inviting me. Yes, I'm a family doctor, proud family doctor, but it's just because in Romania, the family doctors are the main vaccinators. So this is the reason why I was involved from the beginning in this problem. In a second, I will try to go on the slideshow, but I can't. Let me see. I think now, is it visible now? Can you see the slideshow now?
Yes. Yes. Yes.
Okay.
Yes, yes.
I will go with a little speed because I want to show you something in particularly. The vaccination process has run into difficulties from the beginning in Romania, as you probably all know. We are about the last country in vaccination against COVID-19. One of the first reasons is the distrust of the authorities. Practically, population don't trust the politicians, and we have a lot of survey done in the last 5 years that shows probably the same thing. It's a huge trust in doctors and a very low rate of trust in the authorities. Because of this problem, also the vaccination campaign has had the problems because of the way they managed the health crisis and because they didn't communicate properly with the population. We all know this, and we all have sent this on in our offices. This due to an impressive increase in the vaccine hesitancy, which could not be counted in time by the structured communication program. Practically, the politicians didn't have a structured communication campaign for the population. They let all this trouble to the doctors, but also we had big problems with communicating in the media, because a lot of doctors against vaccination or people who were not doctors, but they were anti-vaccines, were allowed to come in media and doing anti-campaign, but the politicians didn't come with a proper campaign to deny all these lies on and to all these myths in the media. So you have to understand, Romanians are people that it's all the time with the eyes in the television, and this was very hard for us. And this is why the vaccine coverage has been and remain low. That's been a great challenges for us because we were just based on our ability to counteract the significant progress made by the vaccine movement. And that started early in 2008, in the moment that the HPV vaccine was introduced in Romania. That was the starting point of the anti-vaccine movement. And because the authorities didn't have a very big effort to counteract against the anti-vaxxers, we had to rethink the communication process between doctors and patients. It took very much time to demystify all patients' opinion, explain which is false and which is not. And we also had major funding problems in the primary care in Romania. Probably you already know that. Extremely low funding. There's a huge disparity between the family medicine and the hospital medicine. Financing in hospital medicine is almost like all European Union, but in family medicine is very, very low. So this is also a barrier and also the bureaucracy in the primary care. So unfortunately, there was no public health authorities general communication plan, no in-tasting training. We had vaccination centers, but everybody was allowed to go there and vaccinate without any training. There was a lot of dentist specialists who led their offices and went to the vaccination center because they were very well paid. and of course, with no much experience in vaccination. So this is why we had to try to do it by ourselves. And what we did was big actions, professional society actions, like online medical education, all kind of activities, workshops, and lots of webinars practicing the motivational interview and other approaches and algorithms that we all used to use in our offices. And what I wanted to show you, even if we had such small time, that was a very important survey we did with the World Bank Group, and that survey was done in December, and we just presented it 2 days ago. A lot of things in this survey, but what I wanted you to see that family doctors are very trusted by their patients. A lot of family doctors are already vaccinated with all the 3 doses. There's a huge percentage of family doctors that being vaccinated give a lot of their personal example and a lot of trust to their patients. We do discussing the vaccine with our patients, and we try to answer their questions about their concerns, and most of the concerns are, as you see in their chronic conditions and the safety of the vaccines. Special conditions, or about trying to see what's happening with the misinformation and the fake news. So almost all the things that we tried was on our own. I hope that I was in time.
Thank you, Sandra. Thank you very much. Yeah, quite interesting and impressive to see how you manage this on your own, as you said. I think we need public support. We need official support. Definitely, we don't always get it at different levels, but it doesn't prevent us from doing the best we can. And you showed us how you did that in Romania. Thank you very much. Now, we have 3 minutes left for questions. And these questions can be asked in the Q&A in the Zoom screen, way up beside the microphone and the video. I have seen 2 questions until now, and these are 2 questions addressed to Vesna, I think. Yes, to Vesna. You answered them in written, Vesna, but maybe you take 1 minute to answer them verbally, orally, because they are interesting questions. It's about the contents of the webinars you created in Croatia, and whether it was the contents was tailored to the auditors, but also whether the approach suggested was tailored to the sociological environment of the healthcare professionals in the different settings. So 2 minutes to answer that, but I'd be very interested to hear you.
Thank you, Dr. De Haller. So regarding the first question that was asked about the needs that came up from the research in Croatia and how they are connected with the webinars, we basically did not provide any kind of research. We just went through our 9 chambers via our campaign and decided to ask all of our healthcare workers who were interested in webinar what are the things that they are mostly concerned about, and what are the topics that they would like to get the answer to. So basically we had the approach where we asked the healthcare workers about their questions and invited our participants, our attendees on webinars, and they had the opportunity to answer all those groups of questions. Most of them were, as I mentioned in my presentation, were connected with the concerns of the general population regarding vaccine accessibility, contraindications, vaccine side effects, and all the different similar topics. So yes, I'm very aware that all the webinars should, especially those who are conducted by the healthcare professionals, need to be evidence-based. So in accordance with the newest facts that we had at certain time, then we invited our professionals and they were just passing the information to our healthcare workers. So yes, answer to the second question is very interesting. It mentions the specially tailored approaches in order to increase the vaccine confidence. Yes, I think that generally there are two factors that need to be fulfilled in order to have a approach that is efficient and focused on vaccine hesitancy. One is that we have professionals who are involved in the processes that are making and tailoring the recommendations and interventions that address vaccine hesitancy from one side, and from the other side, it is of great importance to have a very special, I would say, special approach that is very wide and and takes into account different circumstances of why is vaccine hesitancy happening. So it would be best when we would have a very interdisciplinary approach that where not only healthcare professionals are involved, but all the other public health professionals and different professionals, as Dr. De Haller mentioned, sociologists, and etc.
Thank you very much, Vesna. Another interesting point, definitely. We are at the end of the first part of our webinar, and I'm happy to give the floor back to Heidi. Thank you, Heidi, for introducing the next moderator.
Great, thanks so much. Oh, that was a lot of insights. Thank you so much. I'm just going to turn the floor over to Gary Finnega, the editor of Vaccines Today, who's been a real champion of vaccines for quite a while. And I'm happy he's able to be here today. And over to you, Gary, to moderate the next part of the webinar on addressing vaccine hesitancy in the patient population. Thanks.
Okay, thanks a lot, Heidi. Thanks, everyone, and thanks for inviting me to do this today. Maybe we'll get straight to it. Just to let me remind you that the Q&A function is open. We'll ask as many of your questions as possible at the end, but let's waste no time and go straight to France. We'll hear from Dr. Pierre Verger, who is Director of the Health Observatory in the Provence-Alpes and Côte d'Azur region, and he will give us some insights from France on the role of healthcare provider communication and engagement, with at least a little note on motivational interviewing. So take it away, Pierre, the floor is yours.
Okay, thank you, Gary, for your presentation, and thank you for the organizers to invite me to participate in this webinar. I shall share my screen. Okay, you see the slide? Okay, I'll just start. So this brief presentation will focus on the involvement of HCPs in the COVID vaccination campaign in France and the communication with their patients. To understand, sorry, I have to skip to the next slide, but it does not work, unfortunately. Yes, okay, sorry. To understand the context of this campaign, this slide presents its three main phases. First, during the first semester of last year, the focus was on informing the public and HCPs too about the benefits and safety of COVID vaccines. COVID vaccines coverage among the general population, at least, gradually increased until a ceiling of about 50% at the end of May. At that point, the French government decided to implement coercive measures, such as the health pass and the obligation to be vaccinated for HCPs. During this phase, vaccination coverage jumped to about 90% in the target groups. Finally, at the end of 2021, in the face of the fifth wave of COVID, the government decided to strengthen coercive measures by switching to a vaccine pass, which went into effect in January 2022 and was finally abandoned in mid-March. Despite this new measure, the coverage rate for the first booster dose rate did not exceed 60%. Turning to the role of HCPs in this campaign, I would like first to emphasize their involvement in the territorial health professional communities. These are new structures launched 5 years ago for coordinating care between HCPs in communities. They were set up at the initiative of HCPs and experienced a significant boom during the pandemic crisis. Their contribution to the organization of COVID tests and vaccination was significant and underlines the commitment of HCPs in the community during the vaccination campaign. Despite this, there are still populations that are largely under-vaccinated, such as those in socially deprived areas or also isolated elderly people. The difficulties in using especially e-tools for making appointments has considerably slowed down access to COVID vaccination for these people. Regional health agencies in France had to implement outreach strategies to offer vaccination to these populations. Beyond mass information or education campaigns, HCPs had and still have a key role in motivating patients to vaccinate, but also to address vaccine concerns in a personalized way. To address patients' concerns about vaccination, providing information to patients, or attempting to correct misconception is necessary, but may not be enough to change behavior and may even induce reactance. It is therefore essential that HCPs take into account the principle of motivational interviewing. This principle consists in listening to people first in an empathetic, non-judgmental way, establishing a relationship of trust and valuing the person. The corrective reflex so frequent in HCPs is avoided, and information is only given to patients with their consent, respecting their autonomy. Another central principle is not to try to convince, but to help the patient to identify his, her ambivalences and move forward on the path towards behavior change. There is strong evidence of the effectiveness of motivational interview in many areas of prevention and health, including vaccination, and also in different cultural contexts. In addition, the effectiveness of motivational interview is especially long-lasting because the patient makes the decision himself. In France, there are local initiatives to ensure that HCPs acquire the necessary skills to address their patient vaccine hesitancy, but they are rarely evaluated. In Marseille, for example, the place where I am, Our organization has been conducting interventional research for the past 2 years in collaboration with the University of Sherbrooke to evaluate the impact of training in motivational interview for midwives in maternity wards, interns in general medicine, and also recently for health mediators involved in outreach approaches to vulnerable populations. In particular, we found that training interns in general medicine in using motivational interview improved significantly their self-confidence in addressing vaccine hesitancy. This is the end of my presentation. Thank you for your attention.
Great, thanks a lot, Pierre. Really interesting, and we'll have more discussion at the end. A quick question on motivational interviewing before we move on. It looks like the evidence is very good for this intervention in France, in Canada, and elsewhere. Why doesn't everyone do this? And are GPs hesitant about motivational interviewing because of the time involved?
I would say this is because there is some resistance to use this way of addressing the consultation and vaccine hesitancy, and there are many questions which are raised and that were already raised in Quebec, that are raised in France regarding the translation of the how to extend the use and the training in many GPs, many healthcare workers. There are many questions. So we have started to try to bring a proof of concept first.
Okay, great. Let's see how that goes. It seems very effective where it has been tried. But let's go to Germany next and hear from Philipp Schmidt, who is a behavioral scientist at the University of Erfurt. And Philipp will give us some insights from Germany and some discussion on behavioral strategies. Philipp.
Thank you so much, Gary. Just starting the presentation. Hope you can see that. Right. Okay, just jump right in. Thank you very much for the opportunity to speak here and for the invitation. So what's the situation in Germany? If we look at the data, this is for the general population, then yesterday I looked up at the impfdashboard.de, and on the 3rd of May, that was yesterday, 89,000 vaccine doses were administered in Germany. That means no less than 63 million people, about 75% of the overall population, have now received a basic immunization. But that also means that we have 22% of people who are not yet vaccinated. We conducted 61 cross-sectional online surveys in Germany. About 60,000 people were involved in this and looked at reasons for people not getting vaccinated. And what you see here are associations of vaccination status, not vaccinated, and vaccinated at least once, associated with confidence judgments on a scale from 1, not confident at all, to 7, very confident that COVID-19 vaccines are safe. And as you can see, there is a huge gap between vaccination status and confidence judgments. In fact, if we look at regression models, then the most strongest predictor in all of these models for being vaccinated is vaccination confidence in the general population. So what can we do in Germany about that? If we look at the science barometer 2021 in Germany, then we see who are the people that are most trusted, who should address vaccine confidence, safety, and effectiveness issues. And what we see there is that 79% of people of the science barometer in Germany say that they totally agree that doctors and medical staff are the ones to be trusted when it comes down to coronavirus pandemic information. So yes, that is the time when we should say healthcare workers are needed, and we should have a specific look at that group. If we look at hospital-based surveys from the Robert Koch Institute in Germany, then we also see a very nice trend of people, that means healthcare workers, being more vaccinated over time. Now in Germany, we do have mandatory vaccination, but this data was before mandatory vaccination. And we also see a high increase of vaccination uptake, with only 4% of staff in these hospital-based online surveys who are not vaccinated. But let's have a look at these not vaccinated healthcare workers. If we look at the reasons for not being vaccinated in the RKI survey study, then we see that these people fear lasting damages, they worry about unsafe technology, they fear side effects, and they have fear of infertility. So again, this is a big confidence issue, even among experts. And what we can say here is, yes, healthcare workers are humans too, which means they have the same basic fears and the same confidence issues. If we want to address confidence on a public level and in the general public, then we need healthcare workers, but we also need to address the same kind of issues within that specific target group. And how can we do that? Well, there is lots of psychological research how we can do that, that we summarized in a Nature Reviews Psychology article. There are barriers to belief updating. You cannot simply say to someone, whatever you believe is wrong, and then all of a sudden that person says, oh, yeah, you are right. Now I believe the correct fact. There are barriers to this belief updating. One barrier is there is no link between the correction that we give and the myth. So people don't really know what you're talking about because your correction is just poorly designed. Other reasons are the myth retrieved owing to high myth familiarity or failure to recollection of correction means your correction isn't salient enough to overwhelm the myth. So we have to do something about that and not just state myths are false, here's the correct information. There is best practice guidance on how to do that. Summarized in the Debunking Handbook 2020, you can use a fact sandwich that is much more sophisticated and actually gets rid of very cognitive failures that are related to believing in misinformation. We have even an idea of psychological immunization. That means give people information before they are confronted with misinformation, building up immunity against misinformation by increasing awareness about disinformation campaigns and giving them good fact-based, logic-based, and source-based counter-arguments. If we look at the German health campaigns that are actually in place, then all we really see are awareness campaigns with very simple slogans. And if they do address misinformation and fears that are prominent in general public, but also in healthcare workers, then they are reduced to some very basic statements. These are not sophisticated psychologically and evidence-based countermeasures. Well, across the pandemic, we did have some sophisticated interventions, such as the Go Viral app, which was designed by the Cambridge University, by the team from Sander van der Linden, and was also translated to German. But this is just some university-based approach, and it is not embedded in a systematic and strategic campaign across the country. The same with debunking approaches. There are isolated researchers who did that, and these debunkings were also shared by the Robert Koch Institute, but it was never really embedded in a campaign against misinformation on a very high level or in any strategic way. We also have information about motivational interviewing, and Pierre was just talking about this. That means addressing emotions in a way and feeling empathy rather than just confronting people with cognitive information. And we also shared with the Robert Koch Institute videos about how to do that, but it needs much more for healthcare workers to actually learn motivational interviewing than just to see some video. So what we need are evidence-based approaches, and we do have them. That means we need to train motivational interviewing. We need to build elaborate debunking approaches and design effective inoculation interventions. And if we embed those interventions in a strategic campaign to counter misinformation, train healthcare personnel, and increase vaccine confidence, then I think we do have a chance to target the unvaccinated in Germany. Thank you very much.
Great, thanks a lot, Philip. Yeah, I think if you go back to the H1N1 pandemic, an awful lot of research has happened in the meantime. You know, is it a bit frustrating that that evidence-based approaches like this have not been embraced more by health authorities?
Well, it definitely is frustrating. And I mean, especially interventions like inoculation interventions, where the evidence for that they work is just piling up. We know that this is about the right timing. We need those interventions not when the pandemic is over, but at best when it's not already started. So when no vaccine has hit the market yet, because then they are most effective. People are then building immunity against misinformation that can probably come up, but we are just always too late with that. We need bigger strategic and institutionalized campaigns that actually use this evidence.
Well, maybe for the next pandemic, let's see.
Yeah.
Well, I'll come back to you in a moment, but let's go to social media next. And I think one of the revelations of the pandemic, for me at least, on Twitter and other channels, was Project Halo. So let's hear from Mustafa Aldabas, who's campaign manager at Purpose and communication manager at Team Halo, and also the organizer of the Team Halo sections of the French and German webinars. Okay, Mustafa, go for it. Thanks. You're still on mute, I think.
I'm sorry.
Yeah,
thank you, Gary, and thank you everyone for the time and for the invitation. It's my pleasure to be here representing Team Halo program. Team Halo is an initiative of the United Nations Verified campaign, which was established early in 2020 as a response to the pandemic to debunk and encounter misinformation around COVID, and then to encounter misinformation around vaccines when the vaccine were in developing phase. So Team Halo basically is a community of scientists and experts across the globe. Their main mission is to share science-backed, shareable content in different format to help people to make decisions and to build also vaccine confidence. Since the pandemic, we all have been watching the misinformation circulating over social media, and there was, and when the development of the vaccine was closed, so we started to see also misinformation around the vaccine and the safety. So of course, millions of people were asking questions. There were this kind of uncertainty of what's happening. And that's why we thought this is the time where we have to amplify scientists' voices over social media, because all what we have been seeing before is influencers who are talking about different issues, but not scientists. So we wanted to bring them to social media and to show audience that those people who might be part of developing the vaccine, they are human, they can interact, and they can also answer your questions. So we wanted to bring them from the labs to social media. Sorry. So questions and concerns from the audience that vary from community to another community and from country to country, but underpinning them all is all about trust. We noticed that we cannot reach the audience across the globe with one messenger or one single message. This is why expert voices needed to be amplified in a way that feel relatable to different communities. So we were reaching out to experts from different countries who speak different languages, from different ethnic background and gender. So we wanted to represent all the target audience we want. Today, it was supposed to be with us Dr. Panar Talabani, which is one of Team Halo experts based in the UK, but unfortunately, she's away for urgent things. Dr. Panar is a scientist and a Wellcome Trust Fellow in immunology and a clinical academic trainee in nephrology, transplant medicine. She is currently doing a PhD in immunology looking at the role of the inflammation in organ injury and scarring. Dr. Banana is also active on social media. She publishes content around COVID and the vaccine on Facebook, Twitter, Instagram, and TikTok. The content she usually produced cover the most common COVID vaccine methods that have been circulating throughout the pandemic. Some have gone viral on some platforms. From her experience, she finds that it takes more than one Q&A, which is one of the formats that she's been doing on her platforms. So she thinks that it takes sometimes more than one Q&A interaction to get through the people. But once they have their vaccine, they return asking questions for way to engage with their own families and friends. And I'm going to show you one of her videos, the way she talks to her audience. Oops. There's something wrong with the voice, with the sound, so I will skip this one. So I will specifically talk about the format, which is Q&A. Dr. Panar went online on Instagram with another micro-influencer, Dr. Wala Ubaid. She is a mommy pharmacist cooking micro-influencers and has access to the Muslim community on Australia to address some of the misinformation around COVID vaccine, specifically around COVID causing infertility and the impact of COVID on pregnant women. So during this Q&A live, Dr. Panar was trying to answer all the questions from the audience on science-based information. And actually, during the webinar, some of these women were able to make decision and say, yes, we actually now feel more confident to take the vaccine. These two women who actually shared the video with Banar after the webinar, saying that they are that this content and this Q&A format helped them to make decisions, and their story were featured on BBC. I'm not sure if the sound, but it's fine. Sharing some key evaluation based on a study we did in a controlled environment, experiment with 1,200 people, half of them whom were exposed to 3 pieces of our verified Team Heli content over a period of 10 days. The results shows that the content was most effective among 18-24 years old, increasing intentionality in taking COVID vaccine. And content was successful at persuading people that the vaccine is both effective and safe. The content was also effective in educating people about the vaccine, dispelling myths surrounding it, and reducing feelings of fear. The most effective message were ones that focus on the safety and effectiveness of the vaccine. Overall, people liked the content, and it was easy to understand, informative and educational, but also entertaining. Based on comparison between a control group that received no stimulus, VS test group that's so verified, and Team Halo content. So the coronavirus vaccine is effective at protecting against the virus. The group who didn't see any content, 57% agreed, while the group who saw the content, 64% agreed on that. And that applies also for some of other questions or concerns like coronavirus vaccine will alter the DNA. It clearly shows that all the group or all people who watched Team Hello content, they were highly to believe that the vaccine is safe. Some of the insights shortly of Team Hello. So far, we have more than 120 experts guide across the globe in Latin America, in North America, in Europe and Middle East and India. They have published more than 4,000 videos, and we have over than on their content over than 1,200,000 comments and 250 million views, and tens or hundreds of media articles on media outlets. This is the presentation, and thank you for listening.
Great, thanks a lot. Great to see that evaluation done. It's really really interesting to see real impact there. Very briefly, so quick fire questions. Just one for you, Mustafa. What do you do, or what's your advice on how to handle anti-vaccine comments on social media? Ignore them or engage or something else?
Well, to be honest, this question was like should be like directed to Dr. Banar, but as she's not here, I'm not influencer myself, and I have not been on social media. But from my experience with the guys, because I'm in personal contact with all Team Hello experts, in the beginning of the pandemic, they were trying actually to answer them, because anti-vacciners sometimes are only people who are not well informed about what's right and what's wrong, and they usually follow their fellow friends or on social media, or they are also maybe target to being in an echo chamber where all the information they got are from the same circle. So inform them. But some of them are actually just anti-vacciners, and they are not willing to share their mind. And so the easiest way was to ignore them. And then when some of them were trying actually to report all the content of our experts. So some of them were like, okay, I'm not gonna deal with anti-vaxxers anymore. I'm gonna block them. Because yeah, it's a little tricky sometimes on social media.
Yeah, I'm familiar with this dilemma myself, I can tell you. Great, thanks a lot for that. I see some questions coming in. Maybe let me see, there is one maybe I can bring for Philip about maybe the increasing importance of complacency as we move into a new phase where people have the idea that COVID is not so serious or it's over or whatever. Do you think this is changing the approach that's required?
So that's what we also see in German data, that people don't really perceive the threat on an effective level anymore. They don't really feel that this weaker Omicron is such a big thing anymore. So we see that trend in German data as well. But what we also know from psychological experiments is that complacency can be addressed with empathy communication. And in these experiments, people just showing videos of elderly who actually suffer from COVID, or who are actually having some social issues, they can't visit their wife and so on because of lockdown regulations and so on. And these little videos actually increase vaccine intention and reduce complacency. So if we work with empathy, whenever we see complacency issues, because it's not only about you and how you think how weak the disease is, it actually does affect other people, then people are also more willing to get vaccinated again.
Okay, great. Time is running out, but there is another question. Maybe Pierre, I can give this one to you. This one is from someone who has joined, I think, from Japan, and mentions that sometimes health professionals can be anti-vax. And how do you deal with, or how do you communicate with patients or citizens who maybe are following an anti-vaccine health professional? Is this something you've come across in France, and what do you do about this?
I would say that the term anti-vax is probably a bit exaggerated for HCPs, but it is a fact that there are some HCPs who have raised, for example, not only about the COVID, but for HPV vaccine, some issues. And they have launched a kind of controversy in France and debate. So it's a very difficult question, and there is no simple answer to that. So it's difficult to answer this question in a few seconds.
That's all right. Can I give you another one really quickly? You mentioned about the health pass and other measures that were taken in France. Do you think the legacy of this is that some people who were never vaccinated but became vaccinated because of this will now have higher levels of vaccine uptake? Or do you think it will backfire and some people will lose trust and feel they were coerced?
In a few seconds, I would say that from a certain, I would say, non-negligible percentage of these people, there is a risk of backfire because the level of vaccine hesitancy, even those who have accepted to get vaccinated under the pressure of health pass, are still hesitant. And there are also emotional aspects such as disagreement, grievance regarding the fact to have been forced into vaccination. So there is a non-negligible risk of backfire, yes.
Okay, great. I better stop there. And thank you all for your contributions. I hear a lot of empathy and engagement and a lot less confrontation maybe than we previously are used to in discussions about vaccine confidence. But maybe, although we're over time, and my apologies to all, but I'll hand you back to Heidi to wrap things up. Thanks a lot, everyone.
Oops. Thanks. Thanks so much, Gary, and everyone. I'm just going to say thank you to everyone. I think the Q&As that were interspersed gave us some good room for some discussion. I'm really thrilled with the scope of perspectives that came up, and certainly the country experiences, because it's the front line that matters. And just to say thanks, everyone, and we will be sending a link to the full session to all the participants and speakers. Thanks again.